Ted walked in. Welcome back, everyone. If you hear a woohoo, you know you've got Michael Henderson, and he's the owner of Tapestry Insurance Group. Tell everybody a little about yourself and what you do.
Well, for somebody that's just joining in for the first time and hasn't been on your show or hasn't been listening for the last year, we do Medicare. We help people interpret Medicare. We help people navigate the Medicare market when they're turning 65 or when they go on to Medicare. It's very confusing for people, and so that's what we're here to do. We are educators in the Medicare space.
And just because it's not October doesn't mean that every day isn't a Medicare day, because it is.
That's right, it is. You know, there's as many, if not more, people looking into Medicare now than there were back before the whole COVID thing and all that, because more people are thinking about retiring. People that had worked past 65 are now retiring. The problem is it's harder to get that information, or it seems harder to get
Not here on this show.
No, because I'm here.
That's right. That's what you're here for.
Yeah, you know, there's not as many seminars going on. There's not a lot of in-person stuff where people can get that information now. So me and my agents are set up to get you that information over the phone, through webinars. If we do need to meet with you in person because you don't have internet access or something like that, you know, we bring our masks. We make it safe for people.
Now, here's the thing about what makes you different, besides the fact that you're a seniors advocate out there. You really are. Mm-hmm. And but you service the entire Southwest Valley. I mean, and that means, well, the whole entire Southwest.
Southwest,
doesn't matter.
Yeah.
And so, what happens when you call Michael is that you'll reach his phone.
Yep.
No matter if it's the 800 number or the other one that I give out, and he'll answer it. He actually will answer your call, and what he does is he'll talk to you, find out a little bit about you, and if you need to have help in the other areas, you have a bunch of agents that work for you.
Yep. That
can help you in those areas. And why is that so important?
Well, it's important because a local agent is going to know your market. They're going to know the doctor networks. They're going to know the ins and outs of which plans work, not just the numbers on the plan, not just what a copay is, but actually which plans work and which plans are going to work for your needs. There's a lot of intricacies. Just here in Maricopa County alone, we have over 40 Medicare Advantage plans right now, and I will be willing to bet you that next year for 2021 there's going to be more. And so that doesn't include supplements, that doesn't include PDPs. There's a lot to navigate, and so you can call somebody on a call center, but they're just looking at a computer screen.
Yeah, if you want, but you're not going to want to.
Well, yeah, because they're looking at those numbers on a computer screen. They're just looking at the copays, just like you would out of the book. When you talk to a local agent like us, or an agent, one of my agents that we connect you with, you're going to get a local expert in your community. So they not only know Medicare, but they know how it works in your marketplace. But
also somebody like you,
mm-hmm.
Okay? You can call somebody on television, the 800 number, but this is different. Because when you talk to them, you get to know them. You
mm-hmm.
also can help them in the certain areas, obviously, but you also become their advocate and help them along the way. You're not just answering, have a little thing to fill out, check mark, whatever. You actually get to know your clients and you care about them, so you follow them as well. And that's what also makes you different.
Well, yeah, we're here to help. We're educators. We may not be famous like the guy on TV that's getting you to call the 800 number, but we know the market and we know Medicare and we care about our clients. And we don't charge anything. You're not going to pay us any money to come visit you or to talk with you over the phone and answer your questions. We get paid from the insurance carriers. There's no fee for our service to the actual client. So we can feel good about educating without having to worry about, collecting money.
Right. And that's, for you, you're getting the best information that you can. It's a free service to the families. You can call either his number direct at 602-541-7656 or his number toll free. It's 800-506-8810. He services the entire Southwest Valley. And let me say this too for everybody that's listening, is that this is not something that you ask your friends or your neighbor or your brother or anyone else, because you need to understand that each person has an individual story. That includes the people in your own house.
Yeah, everybody's got individual needs, and your husband or your wife may be on Medicare, but that doesn't mean that plan's going to be the best for you. Everybody has individual medical needs. Everybody has their own financial wherewithal. So we help evaluate that whole picture when we look at Medicare. And what goes into that for the individual person. So,
now, you have the two websites still going now?
yes.
Okay, just want to check before I say it out there. The website is either tapestryinsurancegroup.com, or for now on I'm going to say this one, because they've made it sort of easy for everybody out there. If you want to go online and check out, tell them the story, that you can check out all the different programs that you have.
Yeah, so we have an online service or website where you can actually go on and compare plans yourself, get a little information. If you want to do that before you call us, great. Go in with a little bit of knowledge. We don't mind that, and we'll still help you navigate that. But you can enter your information, and you're able to look at the plans and kind of get a bird's eye view of what's available in your area.
And what's really great is that you get to talk to him afterwards when you've looked at that and find out exactly whether it's right or wrong. Because
Exactly.
I'd hate to do something and then think, oh my God, was that right? Well, he can help you.
Yeah.
Again, check it out on that website, which is MedicareOnlineNow.com. Again, the number to call is 602-541-7656 or toll free 800-506-8810. It's a free service to the families out there.
Yes, it is.
Did you want to say something else more than yes? Because I was going to chime in. Go ahead.
Well, I'll say yes first of all, but
You have to.
we also have a lot. We also are starting to post our events on our Facebook page. So when I say events, these aren't in person. We're doing them virtually now, and they're basically informational events about Medicare. So Medicare 101s, Medicare community meetings, things like that. But they're all online now. Well, not all of them. Eventually, hopefully, we can do them in person again. But right now, you can go to our Facebook page at Tapestry Insurance Group Facebook page. And there is an event tab on there that will show you the dates. We've got events all the way through the end of July posted, I believe, on there now.
He just tells me this for the first time
I
while
know.
he's on the air. Okay, so now your Facebook page, you're
I
going to be
wanna get the
using it a little
secrets
bit
out.
more. And you better put this one on there because we're live on Facebook
Yeah.
too.
Woohoo.
So everybody out there, like us and follow us. But you know what? You could go up on his Facebook page, which is Tapestry Insurance Group. Is that what they
Yep.
go into?
Uh-huh.
And of course, you're going to see all the events there. And what's really important about those events is you can kind of see what you need, right? I'm in for the 101. I think everybody should take a 101 for sure.
Everybody can get their basics on what Medicare is in a 101, just some of the the bird's eye view of Medicare, and then talk to one of us in person to navigate that down into what's good for you in your area. So yeah.
And the time to do it is now. I've asked you a question that I asked you once before. I think it was a couple times that you were on.
Uh-huh.
So right now with this COVID-19 that's going on,
Yeah.
Does it affect anybody with Medicare? How about if somebody has it?
Well,
Does it affect anyone?
actually, it's affected everyone whether you have it or not. Many of the plans now, I can't name names, of course, because we have to get prior authorization to do that. But many of the plans are waiving copays, are waiving the copays. Some of them for primary care doctors, some for even specialists when they go see a doctor.
So the government is actually helping out through there.
Well, or
a
the
little
carrier
bit.
that you're with. If you're
Or the
with a
carrier.
carrier, yeah. So they're waiving those copays. So if you had a $20 copay to go see the doctor, for instance, now through the end of the year, on many of those plans, it's waived.
Well, call now and
Yeah.
find out, because if it's waived and you're not signed up now, that's crazy. You ought to get yourself all checked up and taken care of before the end of the year.
Yeah, and if you don't know if you're on one of the plans that is waiving those, give us a call. We can just let you know.
That number to call him direct at 602-541-7656. The website, I'm just going to do the one that's online because it makes it easier for everyone. It's MedicareOnlineNow.com. Before we go to a break, we usually have some stories. Did you have any this time?
You know, I think we forget to mention sometimes people moving in. I just met with a gentleman this week that moved into the area that needed help with his plan, so we can talk about that too.
Yeah, you know what? It is very important. There's always people moving in, especially right now. I guarantee you more people, because they opened up a little bit right now, that want to be with their families if they hadn't been living here. So the number one question that you get from Medicare is what?
What do I do?
Yeah,
I mean, basically it's what do I do? If they're retiring from their employer or something like that, it's just,
Yeah, I think there's a lot of questions. And
How do I
there's
get it?
so many different alphabets in it,
Yeah.
and you have to make sure that it's right. If it's not right, can you get fined?
So there's late enrollment penalties for Medicare Part B and for prescription drug
And they
coverage.
last a lifetime, I think.
They do. So you can get it for Medicare Part B. You can get a penalty, and that's your basic Medicare A and B. B is your doctor's office visits. You can be penalized for that if you don't take it. You can also be penalized for your Part D, which is your prescription drug plan, if you don't take it in time, if you lose credible coverage. So, yes, there are penalties, and you want to be aware of that.
And it's a free service to you. You would not want to make any mistakes, and that's really important. Especially if you try and go up online and see, well, this is good for me, and then just do it. Always make that phone call to him direct. They're in your area. He knows exactly. You have been doing this for how long now?
Over 10 years,
10
about 10
years,
years,
so he
yeah.
knows what he's talking about, and he's here to help you. He is your seniors advocate. That number to call him direct at 602-541-7656. Hang tight. We'll be back in just a minute. Woohoo! Okay, so we're still live. We're going to kind of stay live on Facebook.
Okay, I'm
So
gonna drink
now
water
that you tell me during the show, so on your Facebook page that you're listing everything there, do you want me to kind of tell them about Facebook more then a little bit?
I mean, just I like
Doesn't
that.
really
Just
matter.
we just mentioned it.
Okay.
I mean, I don't know if we can mention again. Yeah, it's
Okay.
just we're just posting the events on there. Of course, there's the standard Facebook stuff,
Okay.
but it's mostly about the events because I post them on there because that way people can see an event. Like if there's one Wednesday, which there is.
You want to tell them
Yeah, we can. But there's a link to it, so they can go onto Facebook. They can then see the link to the webinar, and they can click right on the link
So
and
they
go
can
right
see it
in.
virtually?
Yeah.
Okay, we'll
Yeah.
talk about that again one more time,
Yeah.
okay?
And it's
Anything
just
else?
started. We just started adding those, so there'll be more and more on
Okay.
there.
Is there anything else that we need to get out?
You know, the copay thing is good for people to know that are already on plans because their copays have been waived if they've been, not going to the doctor because of the cost. They probably can go now and not have to worry about the cost depending on their plan. There's more there are actually, I can't say there are more plans coming in next year, but there are more plans
Okay.
coming in next
Okay,
year.
okay, you just said it anyway, go ahead.
So off the record, no. No, I'm willing to bet
Okay,
there's more
okay.
plans. So, it gets more confusing every year for people. It just does. Medicare doesn't get easier.
Mm-mm. And nobody understands it.
Yeah.
And unfortunately, there's still people that call, they don't understand why they call those people on television.
Advertising works.
Well,
Who says advertising doesn't? Whoever said
On that
advertising
part of it,
doesn't
but I
work?
think it's because it's that somebody they resonate with for some reason.
Why do you think they hired whatever Joe
Yeah,
Namath
yeah.
or whoever it was? Yeah.
They think that they're gonna get him to talk, he's gonna talk to them.
Yeah.
That's probably what it
And
is.
truly, the problem is that those people really are just looking at a computer screen. So you give them your zip code, they type it into their computer, and they just pull up a list of plans, much like they would get just going to our website. They can get the same information that they would get on that phone call many times just by going to our website and typing in their own zip code. So, and no
It's
high pressure
important.
sales tactics either.
This is important. The
Yeah.
people need to know what to do,
So
because no one knows what to do anymore.
we do a lot of stuff to help the seniors and to help, things at food banks and things like that for just because it's what we do, not for any. We spend a lot of money on that kind of stuff because it's worth it for people,
That's neat.
Yeah.
As we get closer to October, things will start. You'll start having a lot more too.
Yeah.
But this COVID thing just made everybody upside down, like
Oh.
crazy.
Crazy, but it
People are
hasn't.
nuts.
It hasn't slowed down a lot because
No,
there's
not-
still
People still are
4,000 people a
working
month
and
aging into Medicare
Plus,
here in
everybody
Maricopa
turns
County.
65 every day. We should say that.
Mm-hmm. Any day's a Medicare day.
Every day is.
That's a good slogan.
So
That's his.
we did it here. I said it here once on the radio that it.
I just said it today.
Yeah, but I mean the first time.
Yes,
it's
but we
not
really
something
ought to
I heard
make
of.
that the website
I think I did buy it. I think I bought it.
because it's perfect.
So
What else? What do you got going on for that? I see you next month. I don't think I see you again this month. I'll have to look.
I think next month.
Yeah.
Yeah. Oh, we're getting ready.
Ready? Thank you.
He's waving his hands around.
He waves. That's his style, though. That's his style. Everybody's different, but he'll be like,
Yeah.
what other people are like, like, he's different. Welcome back, everyone.
Woo!
If you hear the woohoo, we said it before.
You know I'm in the house.
That Michael Henderson is here. He's the owner of Tapestry Insurance Group, and he is your seniors advocate. And what I love about you the most is not only can you help people in the entire Southwest, but that you really are there for your clients. It's a free service. We want you to understand it. It's a free service to you out there, your families, and you can sit down and talk to him. He gets to know you. We were talking at the break. What's the difference? Why people call? And you know what? You're not going to be talking to that person on the television. We want you to know that too.
Yeah, the 800 number is not going to be the famous person that's actually on the ad.
And you can go and check online. He said you can go online and see all this information, but you don't know still.
Yeah.
You don't know until you ask, and that is what you need to do, is make that phone call.
Well, there's no silly questions. Gentleman that called
That moved into the area?
last week. Yeah, he moved into the area, and I had time on my schedule, so I actually went and met with him personally. He moved in from another state, and he was on a plan. When he called the plan to let them know, because you have to let them know that you moved, his rate actually went up by a bit. And obviously he didn't.
No one likes when it goes up like that.
Nobody wants their rate to increase. So, he called actually from the radio show. He's a listener. So if you're out there, you know who you are.
Thank you for listening.
Yeah. And he called, and I went and I did looked up some rates for him. We found a plan the same exact plan through a different company, and we were able to lower his rate. The application's in. It just got turned in. But anyway, so we were able to lower his rate. But that's what we do. He could call the company, which he did, and he could have stayed on that plan that he was on because they changed it to this area. But he was going to be paying more every month for the same exact plan.
And he would never know unless he asked.
Yeah.
And I guarantee you, he's thrilled that he listens to this show.
Yeah. So that's what we do. If you have a mom, a dad, an aunt, and uncle, trust me, they don't understand Medicare probably any more than you do, and let them know, because we're here to help. It's not annual enrollment right now, but everybody's getting prepared for it. We're in what we call the special election period, but you can still call us and ask questions, because there are still opportunities to change even this time of year. Woo, that was a tongue twister.
Tell me about it. So now again, what I think people should do is to be proactive. We've been talking a little bit about being proactive about your health, about all sorts of other things, but being proactive about your Medicare, about all those things. I'm turning 62, so I start. You got that age going on there,
Yeah.
and in your mind, those are the things you start thinking about. All that stuff about being in Medicare is one of them.
Yeah.
And it's exciting that you can be able to get on it, but there's a lot of different questions and things that can cost you money if you make a mistake.
Well, there's tons of things, even from just getting started on Medicare, the basic Medicare, what we call original Medicare. That's A and B from the government. That red, white, and blue card that you get, that's original Medicare. People don't even know how to start that.
I wouldn't know. You just don't call a number, do you?
Yeah, well, ultimately you do. You call Social Security.
You call Michael is what you do.
But it's, there's a lot of questions about it. People don't know what to do. And that's half the time, I don't know, but I'm going to say half the time is people don't know, and so then they get these penalties. And that's just, it's
I think
not
what
right.
also makes it really scary is there's a donut hole.
Mm-hmm.
There's all sorts of different A, B, C's, and D's.
Yep.
There's an F thrown in there too.
Oh yeah.
I think there's more. I think they've added a couple more too.
Yep, they've added more. There's Advantage plans, which are plans that you have copays. A lot of times you don't even have a monthly premium.
And I've said this before many, many, many times. First of all, if you think that you know how to do this yourself, you probably don't.
No.
You don't go to schooling for it like you do. I think it's every year that you go, or more than that.
We have to get certified by every single carrier every year.
And that's a lot.
So I actually go to school like probably over 20 times every year.
Yeah, I'm saying that's a lot. So you don't know, and you cannot go and talk to your husband or your spouse or somebody else, because each one of you are individual. You all take different kinds of medications. Everybody has a different need. And when I hear people that they talk amongst themselves, I say to myself, you're crazy to just try and talk to anybody else, because you need to talk to someone who's experienced.
We can't navigate this. We're taught through our insurance lifetime that we are on the same plan as our family or our co-workers. You're on an employer group plan. You're on the same plan as everybody else at that employer. You're on a family plan with your husband or wife and your kids. You're all on one plan. It's the family plan. So we're taught through our insurance lifetime that our family has to be on the same plan, if not the same plan as other people that do
Like
the same
everybody
thing.
has the same thing. It's
Yeah.
not a cookie cutter.
So with Medicare, it totally changes. Now we're doing it for the individual.
Mm-hmm.
And that's a beautiful thing because we can address each individual's problems. There are plans specifically for diabetes. There are plans specifically for COPD and heart disease and things like that. So it just depends on your situation, what we look at for you.
So, and here's the other thing that I wanted to ask you. With this COVID-19, we've also had a lot of people lose their jobs.
Sure.
What happens with them? Let's say they're in they're fine, they lose their job. What happens to their Medicare?
That's a very good question. So if you have a job and you have group coverage, you're under that group coverage. You have what's called credible coverage. You're safe. You're not getting penalized. Now you lose your job, you can go on to Medicare and get onto a Medicare plan, an Advantage plan or a supplement plan, and you're not going to get penalized because you had credible coverage through your employer. So a lot of people have worked past 65, 66, 67, 70. I had a lady retire.
I'm working till I'm dead.
I had a lady retire at 82. One of my clients.
That's awesome.
Yeah,
I
she
think it's
retired at
neat.
82, and she had never had a Medicare plan before. 82. She no penalty because she had that employer group coverage before that, right? So that's just the thing. If you're retiring now, or you're thinking about retiring because of layoffs or
Maybe you don't want to work
deferrals
anymore.
or whatever they're called from an employer. Yeah, or you just are tired of the rigmarole.
Yeah, you've
Yeah.
been thinking about it for a long time, and now it's time.
Yeah.
But the best thing to do is to call him direct and get that consultation. It is free to you all out there. The number to call is 602-541-7656. Toll free. He services the entire Southwest. It's 800-506-8810. You can also go up on his website. It's MedicareOnlineNow.com. Also, I wanted to get out really quickly because you had said that people now, the co-pays that you wanted to talk about before we left today.
Yeah, so again, like we said earlier in the segment, the copays on many of the Medicare Advantage plans are for doctor's office, for primary care and specialists have gone to zero for the rest of the year. So if you don't know if you get that, make sure to let us know.
Run to the doctor now.
Yeah. Well, if you've been putting off going to the doctor because of the copay, now's your opportunity. Whether you have COVID or not, they're
Right,
waived
and
for
it's
everybody.
not about the COVID
No,
at this point.
they're
They're
waived.
just waiving it for you. So they should call you and find out whether or not they don't call. Who else could they call?
Well, they can call their plan. On the back of their card's going to have an
Okay,
800 number, so they
okay.
could do that. But if they're just curious if their plan has the waived copays, I'm glad to let them know.
And on top of that, I bet you'll talk to them and find out where they're at and
Yeah.
see what they're going to do, because maybe going forward you might be able to find them a plan that's better for them.
There may be an opportunity where they have a better option, or an option that might save them some money, or give them better care for a condition they have.
You know, they say in the insurance world, and actually this really falls, I think, in through any world, whatever. When even your bills, whatever bills you are, your phone bill, or even your, Cox, whatever it is you're on, you got to check it every once in a while,
Yeah.
right?
Yep.
Because if you don't, you just feel comfortable with it. But if you call, then you say, guess what? You might be able to lower it, and that's what this is all about. Go ahead.
Well, they might be on the right plan, but you don't know until you get the information. We are educators first, and insurance people second. So that's what we do.
And they help people navigate through the incredibly very difficult world of Medicare. Again, that number to call him direct, it's 602-541-7656. The 800 number is 800-506-8810. He services the entire Southwest. He answers every call. If he's busy, he will
Leave me a
always
message.
call back. He'll leave a message. He will call you back. And if he doesn't help you in this area, he will help you in the other areas as well. It's a free service to you. Check him out on his website. It's MedicareOnlineNow.com.
Woohoo! That was raw. Tapestry Insurance Group, raw. No.